1662 on improving treatment for patients with Lyme disease and associated tick-borne diseases. This petition was lodged jointly by Janie Kringan and Lorraine Murray. Can I welcome Alexander Burnett MSP, who led the members' business debate on this issue earlier this year. Can I welcome both Janie and Lorraine to the meeting, and thank you very much for attending today. You have the opportunity now to provide a brief opening statement of up to 5 minutes, after which we will move to questions from the committee. Maybe we can ask you to make your statement now.
Thank you very much for inviting us here to discuss improving treatment for patients with Lyme disease and associated tick-borne diseases. Lyme disease is an infection passed to humans by the bite of a tick. It's caused by bacteria known as Borrelia. The best known species is Borrelia burgdorferi, but multiple species exist, of which at least 5 are prevalent in Scotland. Typical initial symptoms of Lyme disease are a bullseye rash and flu-like illness. More serious symptoms may develop weeks, months, or even years later if Lyme disease is left untreated. Later symptoms include joint pain and swelling, headaches, extreme fatigue, and problems affecting the nervous system, heart, membranes surrounding the brain, and spinal cord. If infection is caught early, most patients recover with standard treatment. However, 10 to 20% of patients go on to develop a debilitating chronic illness. On average, 5% of ticks in Scotland are infected with Borrelia. In 1996, there were fewer than 30 laboratory-confirmed cases in Scottish patients, but by 2014 there were around 230. However, the numbers are likely to be much higher because GPs estimate that only 20 to 40% of cases are referred. Lyme disease is not notifiable, and so nobody really knows. However, tests in donated blood have concluded that 4.2% of Scottish blood donors have positive Borrelia serology. That equates to 225,000 people having been infected, although not everyone who's infected has current symptoms. The prevalence of positive serology was even higher in the Highlands, with 8.6% infection around Inverness. Earlier this year, Alexander Burnett, who's here today, submitted a Scottish Parliament motion on Lyme disease, the need to do more. In June, in a Holyrood debate on the motion, Liam Kerr, MSP, stated that Lyme disease is expected to reach epidemic levels by 2028. There are numerous issues with testing and diagnosis. A patient may not remember a tick bite. Nymph ticks are the size of a poppy seed and so easily missed. There may not be a bullseye rash. In a recent Scottish study, only 48% of patients had such a rash. Testing is unreliable. In a recent analysis of test kits, it was found that Lyme disease generated over 500 times more false negative results than HIV testing. In addition, immune response has been found to be undulatory, and so test results can be negative during infection. And there are no tests for 2 of the 5 species found in Scotland. And ticks can transmit multiple infections from a single bite. Co-infections have been found to increase the length and severity of illness, and there are no tests which cover all species of such co-infections. Given the unreliability of testing, it's very easy for Lyme disease and its related co-infections to be misdiagnosed. And there are issues with treatment. There are a huge number of uncertainties in the treatment of Lyme disease. However, there have now been over 700 peer-reviewed papers demonstrating persistence of Borrelia after antibiotic treatment. As Dr. Berkowitz, a Lyme disease consultant who spoke in Holyrood in June, stated, there is now a mountain of good and indisputable scientific evidence that Lyme disease and its co-infections can become persistent, and that various organisms have survival techniques to survive and even thrive through courses of antibiotics. In fact, Borrelia has been found to be one of the most complex bacteria known to man. Treatment of Lyme disease in Scotland has used guidelines developed by the Infectious Diseases Society of America, or IDSA. These guidelines were developed in 2006, before the recent medical understanding of the complexities of Borrelia and persistence. They have been removed from the US National Guidelines Clearinghouse because they are now considered too out of date, and IDSA have not produced more recent guidelines. The British Infection Association issued a position paper in 2011. In it, they support the IDSA point of view, stating that a diagnosis of chronic Lyme disease should not be made without clinical or laboratory evidence. Without reliable tests for Lyme disease and co-infections, there is no evidence to allow patients to get treated appropriately. Abandoned by NHS Scotland, many patients, including ourselves, seek private treatment abroad. So, what needs to be done? Firstly, improve testing. Provide a test which does not rely on antibodies. A commercial Lyme antigen test which does not depend on the presence of antibodies and is described as a game-changing tool for Lyme disease diagnosis is now available in Europe but not yet available to Scottish patients. And provide more testing for all Borrelia species and co-infections. Secondly, improve treatment. Provide better guidelines. Guidelines are needed which acknowledge the recent research showing that Lyme bacteria can persist through courses of antibiotics. NICE has been asked by NHS England to develop guidance on the diagnosis and management of Lyme disease. This is expected to be published next year. If these guidelines do not acknowledge persistence, then Scotland should develop our own and establish a specialist treatment centre. We want a Scottish vector-borne illness treatment centre to be established to deal with complex cases involving a multidisciplinary team of specialists in infectious diseases, immunology, functional medicine and nutrition, and provide resources for research and development into the treatment of chronic tick-borne infections in Scotland. And thirdly, improve education. Teach consultants, GPs and medical students to ensure they're fully up to date on the persistence of Borrelia and co-infections and the complexity of treatment. And teach the public to ensure that they understand the dangers and how to protect themselves. We want to see landowners being required to display suitable warning notices at, for example, visitor centres and car parks. We call on the medical and political leaders in Scotland to follow France's example in ensuring that the recent acknowledgement of the complexities of Lyme disease is followed by a change of policy regarding treatment and that more resources are put into tackling a condition which is increasing in prevalence, has a great danger of negatively affecting the tourist industry and is placing a burden on the wider economy of Scotland. If Lyme disease is going to reach epidemic levels by 2028, now is the time to act.
Thank you very much for that, Nat, and I appreciate there's something very personal to you and therefore it's ever more powerful in terms of the evidence that you've given. Can I ask you, though, in your petition, you state that you have written a report for discussion with the Chief Medical Officer and you also met with Healthcare Improvement Scotland. I wonder what outcomes or feedback you've received from these discussions.
I got a letter back from the Chief Medical Officer who agreed with many of the points that I was making but didn't commit to any change. I had a meeting with Dame Denise Coya and she was very supportive of what I was telling her and has continued to keep in touch.
But there have been no specific commitments made?
There's been no action at the moment. Well, that's not the case. Dame Denise Coya has met with lots of people and has been involved in discussions, I believe.
Okay, thank you very much for that. Brian Whittle?
Thank you, Vera, and thank you. Good morning. Thank you very much for your evidence. I have to say, I have a little bit of personal about this as well, because I know that one of the athletes down the track contracted Lyme disease, and that was actually down to apparently the grass not being cut often enough down at the stadium. So I have a little bit of understanding of this particular issue. You said there are numerous issues with testing, and if I could explore that with you, if I may. You've quoted Lyme Disease Action as saying there are no conclusive tests currently in use in the UK that will accurately diagnose Lyme disease or distinguish from past infection. Are you aware of other countries that do have this? I know you've kind of alluded to that before, but other countries that do have these tests?
A lot of the tests that are there there are no markers of active infection for Borrelia, and that's part of the problem. This new Lyme antigen test may prove to be the thing which changes that, but I think it's too early to know.
Okay, can I ask a supplementary?
Can I just add to this? There is actually another test out there called the LTT Melissa test, which they are using on people that are not being picked up with the blood test. And the way that works is the conventional laboratory diagnosis involves demonstration of Borrelia antibodies in ELISA, followed by confirmation of positive results in Western blot. However, due to cross-reactivity with antigenically related microorganisms, Epstein-Barr viruses, things like that, delayed or failed antibody production or IgM persistence, serological diagnosis alone is often ambiguous. And this is where this LTT comes into place. It's called a memory lymphocyte simulation assay, and it differs from the ELISA in the Western blot because the foreign antigen, part of the Lyme bacterium, is added to the patient's blood, and the degree of lymphocytic reaction is measured from this. So they actually add the bacteria, and if there is a response with the memory cells, that's how they detect it.
Okay.
That test is used in Germany.
It's used in Germany and also the United States, some places there.
Is there reports on the success rate? Do we have?
I'm not aware of the statistics, but I'm sure they will be out there. There's certainly all the people that are coming back negative with expecting an immune response are being picked up with this other test, because they more focus on your memory cells rather than relying on the antibodies. Because what you have to realise is Lyme disease and all these different co-infections you get actually suppress your immune system. So that's what the test is based on.
You've identified some other issues there, including cost and the lack of sensitivity of tests and the difficulties it creates in terms of being used in the market for treatment response. The briefing that has been prepared for us refers to the online guidance which identifies the possibility of false positive results. A number of comments received on the petition mentioned false negatives. I wonder if you could comment on that.
There is a lot of controversy in the area of Lyme disease, and so you'll read different things from different places. But there are different definitions of Lyme disease. Lyme disease can be thought of as being caused by Borrelia burgdorferi, but there are multiple species, and so we need tests which will cover the whole range of infections. And when people are talking about Lyme disease and they're specifically thinking about Borrelia burgdorferi, there is more information, there are more tests, and there is more research having been done. But patients need more than that, because there are at least 5 species in Scotland, 2 of which there are no tests for at all. And so it's so easy to get a false negative because they're not testing for the species that you happen to be infected with. And this is what's happened to me. I was first tested in 2007 and told that I had a high level of antibodies, but they didn't know what it was. And I was given a clinical diagnosis of Lyme disease at the Western General here in Edinburgh. I had 3 years of treatment, and then at the end of the 3 years they said, you've had the treatment, you've no doubt had Lyme disease, but there's nothing more we can do for you, and so you're discharged. At that point I was really seriously still ill and went for private treatment, and it was 4 years later when I had a positive test for Borrelia guerini, and I then later found out that the original test that I was having in the hospital in Edinburgh never tested for Borrelia guerini. It wasn't part of the test which took place at that time, and therefore I had, from the point of bite until I got an actual test result that came out with anything, was 10 years, and in that time I had become too ill to recover.
Thank you.
Michelle, you wanted a brief supplementary, Michelle?
Yeah, I just wanted clarification. Are you saying that the LTT test can actually, on a retest of the false negatives, will pick up all the elements of Borrelia, including the 2 that we can't currently test for?
We're not experts in the medical side of things, but many patients are being diagnosed using the LTT Melissa test, where when they're tested in the UK, they're not being given a diagnosis. They're not given a diagnosis, and therefore they don't get treatment, and they then go abroad to get treatment to try and get an answer to what's wrong. And in using this test, they get an answer. It may not be the full answer.
But what it will presumably say, because the increased activity in that memory recognition will tell them there's something going on, but not necessarily the form of Borrelia that's present.
Well, it depends on the Borrelia that's been added to the test. Right. And obviously they have about 20 different strains. Obviously they use the most common European strains. And they also test for co-infections as well, like Babesia, which is a parasite. Yeah. I've actually got that, which I got from a tick. In the NHS in this country couldn't test for it.
There are many tests that are not available here. I believe I may have also been infected with Bartonella at the same time in the tick bite, and I've asked for Bartonella testing to be done and been told that there are no Bartonella tests done in Scotland now. And I've also there are multiple species of Babesia, and I've only been tested for one of them.
Can I ask if you have an understanding of whether there's a consistency of testing across Scotland? I mean, clearly you're saying there are some tests that are not available in Scotland, but is it different within Scotland? Or would you know that?
No, I believe it's consistent. That's consistent throughout Scotland.
Okay, thank you. Rona Mackay?
Thank you. Good morning. Can I move on to discuss treatment? You say in your petition that the current guidelines used in Scotland were developed in America in 2006 and are now considered out of date in America. So I wonder if you could expand on your concerns about that and what they are, basically what the guidelines are, and why you're concerned that they'll be out of date here too.
The guidelines used in the UK recommend 2 to 4 weeks of antibiotic treatment. And in some cases they recommend that you have intravenous antibiotic treatment, but mostly it's oral.
So how does that compare with the ones published in America? Is that the same?
That's the guidelines being used here are based on the out-of-date guidelines from the States.
Right.
But many doctors particularly in the US, believe that long-term treatment is necessary to treat Lyme, and that it must be much more aggressively treated because of the persistence.
Yeah. And the tendency here is to stick to those 2006 guidelines?
Very much so,
yeah.
Yes.
Okay.
Yes.
The research has moved on since then. They're discovering that the Borrelia bacteria is a very clever bacteria. It can go into biofilms, it can go into cyst form. So they've discovered that a multi-antibiotic approach to cover all the co-infections as well that's been found is getting people well. And it's not a quick treatment. This is done over years.
What would your sort of preferred options be for treatment? You know, if you could say, right, you know, this is how we would change it, what would you prefer to have done?
I would love them just to go with research that's already out there. There's a doctor called Dr. Horowitz from New York. He's actually gone as far as writing and designing symptom checklists for patients and doctors. And from that, he can narrow down the chances of, for instance, you having the co-infection Babesia along with the Borrelia bacteria that cause Lyme disease purely by symptoms. And with that, that determines what medication each person has. That's the way they work. So they actually don't really focus on tests,
right?
Because they're so up to date with the symptoms that cause and the progression of the different bacterial infections or parasites.
And are there any specialists in Scotland that you know of?
No. Not aware of any.
Well, in terms of testing, Roger Evans at Raigmore has been involved in a lot of the test
when it comes
side of
to
things.
treatment,
but treatment,
if you're diagnosed, there's no top, 6 people or anybody that might be called in for anything?
We don't know of, we as patients
Yeah.
don't know of anyone who has been helped significantly by
A particular
care in
person?
Scotland.
Yeah. Okay, thank you.
Can I just make you aware of what actually happens to us patients? Well, basically, these are the ones that might not have noticed the tick or the bullseye rash. They might not have even developed the rash that might have alerted them to the fact they were past the bacteria. They go to their local doctors, and they've actually been missed, obviously, from the doctors because they're not aware of the symptoms and they're not familiar with the progression of the way Lyme disease might never have seen a case before. These patients, like myself, was diagnosed with chronic fatigue syndrome, so every single symptom I had was obviously brushed under that. These patients sometimes never mount an antibody response to the current test, especially if they've been left years, as their bodies are so overwhelmed by all the infections. Ironically, Lyme disease causes immune suppression, so it's no surprise really that there is no response. So these people without positive tests or adequate treatment are left seriously ill and often moved about the NHS system without an accurate diagnosis. They must be passed to infectious disease specialists but will be denied further treatment as they haven't tested positive. What is more alarming is the fact these patients have all the classic symptoms and the progression of Lyme disease. Unfortunately, they are denied treatment because the NHS relies on outdated guidelines and limited tests. And the symptoms, I mean, they're just completely ignored.
Can I just interrupt there for a moment? If you went to the doctor and said, look, I feel dreadful and I actually was bitten by a tick, would that obviously spark off you getting sent for immediate treatment? Or, you know, is it up to you to say, or I mean, if you went in with those symptoms, they wouldn't necessarily suspect that it was Lyme disease?
I don't know whether it might be slightly different now than when I first got bitten, but I got bitten in 2004. I know the exact date I got bitten.
Yeah.
I went to the doctor with a rash and initial flu-like illness.
Yeah.
And the GP that I saw at the time, the first thing he said was, have you been anywhere in America where you could have got Lyme disease?
Right.
But he didn't believe that you could get it in Britain.
Oh, right, okay.
And so...
And were you aware that you had been bitten at that point?
Yes. And so that opportunity for treatment was completely missed.
Okay.
So what's
and so, you know, there are people who they may not have understood that they've been bitten, they may not have had a bullseye rash, and so they've got even less chance
of being picked up.
Of it being picked up than it did with us.
Yeah. Okay, thank you.
Thank you. Michelle Ballantyne.
Yeah, following on from the issue of treatment, you've indicated that you'd like to see the establishment of a Scottish vector-borne illness treatment centre with a multidisciplinary team in place. Can you sort of expand on this suggestion and tell us what it is you'd like to see? Because you've obviously already indicated that there's a lack of specialists on Lyme disease, so we'd be starting from quite a low point, I suppose.
With Lyme disease, it's a multisystemic illness, and so it has all sorts of implications. And we feel that infectious diseases, although you know there is an element of that specialty is not sufficient to cover the whole range of things which happen. These infections can modulate the biochemical mechanisms which occur in the body and therefore need functional medicine specialists in order to be able to understand that. For instance, you might need supplementation with vitamins and other supplements in order to be able to compensate for those sort of things which happen. There are nutritional aspects to things which come about. The Lyme disease for me caused a complete intolerance to gluten, and I've had to modify my diet significantly in order to stay stable. And so it would be really helpful to have specialists who could cover that side of things. We don't believe that any one specialty has enough enough. If you're focusing on a specialty, you're not focusing on the complete whole of that person. And because it's multisystemic and because it has so many consequences, we believe it would be much better treated with multiple specialties. And that's what patients are getting when they go abroad for treatment. They get organisations which are geared up to having multiple specialties looking after their patients.
And have you had much support, I mean, through your journey, because you've obviously been seeing a lot of people over a long period of time, have you had much support from the medical profession at your sort of operational level in terms of some of these suggestions, or have they come from yourself?
There's been
there is no support for someone like us out there that's been affected with Lyme disease. If you don't get better from a couple of weeks antibiotics that you're offered, you're basically just left on the shelf, seriously ill.
I was discharged in 2010 by the Western General here and told they could do no more for me. I asked for a second opinion from Glasgow and they refused to see me because I'd never had a positive test. My GP then decided that because 2 consultants had said that they wouldn't help, that he would not help either. And so between 2010 and about 2 years ago, I had no help at all from the NHS.
And that was from the infectious diseases department at the Western.
Infectious diseases. It was from my GP. I felt completely abandoned with no help at all. I've gone for private help and I've survived with that.
And the model you're talking about, does that exist in other countries?
Yes, it exists in America privately, and France has a national plan for Lyme disease and is setting up specialist treatment centres throughout France, and so they have that model in mind, if not fully implemented.
Right. Okay, thank you.
Thanks, MacDonald.
Okay, thanks, Camille. Firstly, I'd like to thank Janie and Lorraine for bringing this petition to us. I had thought until now that a Lyme disease test had been fairly straightforward, and having had a number of tick bites myself over the years, it's actually been on my to-do list to have the test. However, I didn't realise it was far from straightforward. The final aspect of your petition relates to education and public awareness. So in terms of education, what roles within the medical profession do you feel would benefit from education? And do you have any thoughts on who might deliver the relevant education?
I think it's...
And also how it would be delivered.
I think the need for education is at every level. A lot of the barriers that patients are finding is when we reach the consultants, that they are following the guidelines, and therefore we're then being abandoned because the guidelines are being followed, and then we just drop off the end of the treatment. And so we would like to see a specialist treatment centre being set up, which would involve consultants going to work with doctors who believe in the persistence of chronic Lyme disease, and would therefore learn from them, and then other consultants within Scotland could then learn from the specialist treatment centre. And there's also a need for GPs to be brought up to date with the treatment, and clearly as medical students come through, that needs to be considered as well.
Can I just add to the list for GPs? I think a really good idea that could be rolled out immediately would be to have the symptom list and the progression of Lyme disease, and from that it's like a multi-systemic infectious table that's already out there. From that they can immediately see that the patient's been sick for a few years that have not been picked up, if they'd be likely to be suffering from Lyme disease, regardless that their tests came back negative. Something like that could be rolled out to all the doctors within the National Health Service.
There is some training already out there. Lyme Disease Action produced some training in conjunction with the Royal College of General Practitioners, and so there is an online training course available, and it's included as part of their continuing professional development element of their training. But the last I heard, only 3% of general practitioners had actually taken that training.
And it doesn't really alert to all the symptoms of Lyme disease.
And it's also somewhat out of date now.
Yeah.
And of course, you'll also have the issue of urban GPs maybe not being as aware of it as
yes, it's
GPs in rural areas.
It's my understanding that a lot of the GPs in the Highlands are much better educated than elsewhere.
Mm-hmm. Yeah. Okay, you'll also be aware that there's been significant or some media interest with regard to coverage of Lyme disease recently. And that includes support for your petition from gamekeepers and moorland managers. Are you encouraged by that?
Yes, yes.
Okay.
We've had a lot of mention of support, if not publicly, at least privately. And there have been a number of bodies who've been in touch and said that they're prepared to support.
Okay, and what other initiatives or stakeholders' involvement can you see raising awareness out there?
We would even like to go as far as national trust services, you know, like monuments and things that are out in the country. We would really like it. Awareness rolled out everywhere if possible, especially Lake District. I believe there's now leaflets there, but there's someone else that's suffering from Lyme disease putting the leaflets there, you know. There's just not much information out there for the public.
The leaflet's been funded privately, it hasn't been?
Yeah, from the charities, Lyme Disease Action, you know, we ring them up and say, can we have some leaflets? And then I go down and I put them in my GP surgery. That's basically all the awareness that's done.
Yeah. Okay, thank you.
There are a lot of stakeholders that would have an input into this, and I have a list of potential doctors and organisations that might be of interest in terms of.
With us, that would be useful. Can
yes.
I just take Alexander Burnett, and then I think we need to wind up just in terms of time.
Can I thank the convener for allowing me to attend today and speak to the petition, and can I thank Janie and Lorraine for informing the committee on what's a truly terrible and debilitating disease. Yeah, for my part, as you mentioned, we held a private members' debate earlier in the year, which I'm very grateful for cross-party support that it received, not only from all those of us with rural constituencies where this was, maybe there's a misconception that this was only occurring in, but I think, as Angus MacDonald's alluded to, we've been very successful in getting more people into the countryside from urban areas, and that's brought its own challenge as well, that they're often returning back to their homes and their local GPs in urban areas who are not aware of the problems, and so that goes right to the point of awareness and education. After the debate, we also held an event here which was extremely well attended. I know there have been some problems with people signing the petition, some IT issues, so certainly the numbers that attended the event are greater than the number that seem to have been able to sign the petition here, and I think that should be noted for the record. It was attended not only by people from all across Scotland, people suffering, but also people working to try and eradicate the disease through removing vectors for ticks, but also attended by people from across the United Kingdom and also from abroad. So I think it should be recognised as a truly global issue that we have an opportunity to address today. What I find so terrible is that this Parliament has looked at this Lyme disease now for over 10 years, and I think it has a responsibility both to sufferers and to countryside users. We are currently encouraging schools, people on Duke of Edinburgh schemes, scouts, guides, all ranges of ages and groups of people to go out to the countryside, yet we are failing them, and I think being negligent in informing them of the dangers and the very grave dangers that exist, and if they were to catch Lyme disease. It is clearly a disease that is not getting the attention it needs, and I hope that the Petitions Committee today takes the opportunity to address that, and in turn the Scottish Parliament takes the opportunity to catch up with so many other countries which are dealing with it. Thank you.
Thank you very much for that. Can I just maybe ask one very last thing? You mentioned the development of NICE guidelines in your opening statement. In the feedback that you received from the Chief Medical Officer in Health Improvement Scotland, has there been any reference made to the development of sign guidelines?
No, there hasn't.
No. That's obviously something that we can pursue. Can I thank you very much for your attendance? We now need to think about how we want to take this petition forward. My sense is that we do want to take it forward. I think the issue of responsibility around something that clearly this whole area of work needs to be developed. Powerful arguments for that today. Can I have suggestions from the committee about what we now do? Rona?
The Scottish Government and the UK Government and the various interested stakeholders, Lyme Disease UK, Lyme Disease Action, SNH, NICE, and also I was quite shocked to hear that only 3% of GPs had taken up the training. So could we maybe write to the GP body, I don't know what you call it, but just to ask them about that and get the response to that.
Okay, and if the witnesses, as you think you've already suggested, you have suggestions for stakeholders that would be worthwhile our contacting, you can obviously just feed that back to the clerks. That would be excellent. We can get that at the end of the meeting. And I think that we would be obviously keen that this matter has progressed. I think there's a whole range there that we've suggested, and perhaps suggesting also in NHS boards, because they must be given advice within their own systems.
Yeah.
Angus?
Convener, thanks. Could I also suggest we write to NFUS and Scottish Land and Estates to get their views on the issue as well?
I don't know what the body is for the Veterinary Council as well, but funny enough, Lyme disease has been well promoted through the equine world at the moment. There's a growing awareness, and they seem to be doing quite a good job. So it might be worth linking up with some of the animal welfare side as well.
Okay.
Protection Network's Lyme Disease subgroup is Professor Dominic Meller, who's a vet, and he would be well worth contacting.
Yeah. Okay. As I've said, if there's a list there that we can, ensure the clerks have access to, then we can make sure that we get as much information back as possible.
Is there any way that we could get information from, like, so the doctors that have all the research and are curing people at the moment, like Dr. Horowitz, because I think he'd be quite happy to work with the government?
Well, my sense would be in the first instance we should write to stakeholders. You clearly have somebody who is regarded as an expert elsewhere, and that's something that we can reflect on further once we know what the medical profession and other related organisations within Scotland and the UK are actually doing. But that's not something we would close our door to, I don't think, at all. Can I again thank the petitioners very much for your evidence, and can I suspend the meeting briefly to allow for a change of witnesses. We will be coming back to you about the whole issue of responses we've received and when we'll next be considering the petition, and you'll have an opportunity to respond further. Thank you.